One of the things that people are really interested in right now is how technologies like AI are entering into the system.
There are many roles in healthcare which I would say act as the glue, but they are spending more than 75% of their times doing these kinds of below license things.
So there's so many ways that we can talk about getting care and the technology associated with that care. And one of the things that people are really interested in right now is how technologies like AI are entering into the system. And this has been your forte at this point. So I wanted to get some of your perspective of how you're utilizing AI in healthcare.
Yeah, and I think certainly there's a lot of interest in AI as a topic more recently, but versions of that, especially machine learning, we've been using from the very get-go. My engineering graduate work was in signal processing and machine learning, so all the way back 10 years ago, it's been a foundational element of Qventus, is how we use machine learning and how we use behavior science to first predict the operational challenges, and doing them in a predicting them in a way that also accounts for the human behavior that you're eventually trying to change, right? So, for example, it might be very easy for me to predict that a surgeon may or may not have need for the time they have reserved in the operating room. But that alone is not enough. I have to understand that that surgeon is also optimizing for is that patient who might walk up in their clinic and who might need a surgery sooner, and therefore they would want to keep that reservation for a little longer. So by understanding that behavioral context, what do I predict? How do I predict? That has been the machine learning and behavior science interwoven that we've done for the longest time. I think what that has allowed us to do is go from data being available in the healthcare system to predicting the operational challenges to then optimizing what decisions you can do to maximize that patient's access. I think one of the things we actually recently announced our new AI operational assistants, which take that a step further. They turbocharge the ability of that intelligence that exists with the ability to automate the thousands of manual tasks that have to then happen after that for a patient to receive good care. So those could be phone calls, faxes, calling to a skilled nursing facility to get understand if there's space for the patient to go to after the hospital stay, calling another doctor's office to get that missing echo report. There are many roles in healthcare which I would say act as the glue to keep these things going. And those are roles of some of the best, nurses and MAs and schedulers who have some degree of clinical understanding, or a vast degree of clinical understanding in some situations, but they are spending more than 75% of their times doing these kinds of below license things, staying on hold with an insurer, calling up another office, waiting for the fax to come in. So these AI assistants are now using a lot of generative models on top of the machine learning models to then do a lot of these manual tasks in a way that takes all that capacity that was used up by the healthcare staff and instead lets them have the capacity to do what they're best at, which is to treat people and take care of patients. And the AI assistants, do the rote phone calls, they read the faxes, they assess if an escalation is needed based on new information. And that I think has been really powerful. And actually, the power of it comes really from I would say, the multiplicative effect of both of these things working together, so that these assistants aren't just like a thin AI wrapper, which I think, especially with LLMs, it's actually a lot easier to build a thin AI wrapper than it is to take it all the way integrated and fully working. So what makes these magical is that we use that entirety of the platform that we built over the last decade to enable these assistants to get the full context of the patient's data, to enable them in the workflow, so that the predictions and the machine learning models that are prioritizing what should be happening right now, that context is coming to these agents, and then the task can get automated fully as well. So it's the combination of all of those AI pieces, the machine learning, the supervised machine learning, and the generative concepts that then help take the entirety of the flow from the beginning to the end.